Hello and welcome to InsuranceAsia News. I'm Kristina Shperlik, senior reporter, and I have with me today Kumud Bordoloi, head of accident and health at PICRE. Welcome, Kumud. Today we will talk about managing health portfolios in Southeast Asia from a P&C reinsurer perspective. And my first question for you, Kumud, is what challenges do non-life carriers face when it comes to health claims and underwriting?
In short, non-life companies are facing more challenges because of the complexity around health claims and underwriting due to the medical complexity around the medical science itself or the human health, inadequate data. So let me start with the underwriting challenges. Means underwriters are dependent in non-life insurer side on the declared information in the application stage. So they have to make their decision based on whatever information the clients are disclosing or the policyholder applicants are disclosing. They cannot seek further credible information which is non-manipulative. When I say non-manipulative data, in sense like medical reports or the past hospital information. Number two, the limited availability of relevant comorbidity data sets on a clinical side from insurance standpoint. Number third is around the tools which are not design specific. There are a lot of global tools, underwriting tools available, but not really designed for Southeast Asian market or the market itself, Asian market itself. So that's where we, as an underwriter, we struggle, or non-P&C underwriter, they are struggling to make an assessment. With these points, actually it brings back now to on the claim side, which make more difficult. If we are not able to underwrite or assess the risk at the front more adequately, then the claims challenges are much higher. Number one on claim side is unstructured healthcare system. The information what is coming to the claim assessors, they have to rely on the documents what they receive. And the medical subject itself or the claims information around the medical science itself is too complex. So they are sometimes facing a lot of challenges how to interpret the insurance medicine part of it. Number two, the claim systems. These are legacy systems. What it means is that these systems are designed for more to process claims. Third, because of the fragmented or poor data quality, what they are able to receive from the different claim system, the strategy making on fraud-based abuse, they are not able to make much. If the companies are putting a right strategy and the senior management put a commitment, actually they can overcome all these challenges.
I mean, apparently there is a number of challenges in the region, right? I mean, we are all aware of scarcity of data. So if I may ask, how can P&C carriers maintain a sustainable health portfolio through effective claims management and risk diversification?
In an environment where health risk is getting more complicated and unpredictable, the effective claim management and risk diversifications are crucial. It's not become a part of strategy, it's essential now. So let's start with the effective claim management because it sits on the core of the health portfolio. To start, the first point on the effective claim management is non-life insurers have to start thinking about need to be more proactive than reactive, which as a philosophy. What it means is they can early intervene, come up with a strategy and control the claims trends. Number two, implementation of advanced data analytics to identify the trends and patterns which can help them to set the fraud-based abuse strategies. Number three is they have to build a stronger relationship with the providers and the hospitals or clinics by which they can achieve better price negotiation and which effectively give them more control on the claims outcome. From this, the risk diversification piece is more around how they can build the portfolio, diversified portfolio. Number one, they can do more around geographical diversification. As we know, health by region, when we move around, people health conditions are different. So if they can create a portfolio which is more diversified, then at the single event cause of claim it can be minimized, especially around the health endemics. Number two, on a product side, they can not relying on a single benefit coverage. They can bring different other benefit health products into the portfolio, so that it can balance out the entire portfolio's profitability. On the last is the composition of the portfolio itself. What it means is the mix of policies. When we say policies, we can create high risk, low severity, low risk, high severity, different races, different age bands of people in the policy portfolio, so that one particular events not impact the whole portfolio loss profitability.
I think you've mentioned many things that P&C insurers have to keep in mind, right? What can reinsurers do to support P&C carriers in mitigating health insurance pain points?
Number one, they can bring expertise, provide expertise. What it means is because reinsurers' presence are global presence, so they can bring best learning from different geographical or different regions, geographies and regions, and try to share with the teams. Number two, they can help on data analytics, because data analytics is the starting point for managing a good portfolio. So this big data sets, they can able to know what the benchmark trend lines look like for the markets. So they can help teams to do better pricing, risk management, claims management, and product redesigning. Number three, on training, because as health is a complex subject, so there are a lot of trainings which can be provided on a different topics like fraud management, fraud identifiers, claims management, product design, definition itself, how it's work. The last but not the least is collaborating on new product design or new product development, because every market is unique. There are a lot of opportunities to grow. Reinsurer can help to steer the product team and the client, non-life insurer, to gain the segments which are untouched or not done yet, or the channels which they are most stronger. So by focusing all these different ways, actually reinsurer can help to build the sustainable portfolio for the end customer along with the direct companies.
Thank you, Kumud, for sharing your insights. It was a pleasure having you with us today.
Thank you very much, Kristina.